there are so many people that are out there who either have outlived their family, they may be divorced, they may be a widow or widower, or their family may be all over the world, and they are taking full responsibility for what their steps are in their care. And for these solo agers, building that personal village is even more important.
Hey y'all, it's Kosta. Today I'm here with my guest, Steve Gurney, founder and CEO of Positive Aging Community, author and senior living advocate of over 30 years. Now, before we get into the episode, I want to talk about your own personal journey with care. Like so many of us, you've come into this industry through necessity. Will you tell us a bit more about how your family's experience with caregiving inspired your career?
My journey began when I was in college. My grandfather needed care. He had a stroke. He was paralyzed, needed to go to a nursing home. I saw firsthand what my family had to go through to make that challenging life decision. And it kind of surprised me that there wasn't a guidebook that would help people through that difficult journey. And so fast forward, I graduated from college, didn't have the greatest job in the world, and I decided, hey, look, I'm going to put together a guide, and it'll be a great something that shows that I'm a self-starter on my resume, maybe get me into a fancy grad school. And I started what is called now the Positive Aging Source Book. Back then it was called the Guide to Retirement Living. And much to my surprise, folks really embraced it because there really wasn't a comprehensive listing. You would be discharged from the hospital and the social worker would tell you, here's where you're going to go, versus being able to see all the different options. So I've been doing that for about 33 years. I'm based here in the Washington, D.C. metro area. But the print publication covers the entire mid-Atlantic from Philadelphia to Northern Virginia, but our articles and all the things that we do are not location specific. I did have an interesting path where I ended up selling the business to the Washington Post, and I ran it under their ownership for over 20 years. And about 4 years ago, I had an opportunity to buy the company back, and I'm running it on my own again. So
can I ask, what was it like, the feedback that you got, especially early on when you released your book? What was the feedback like? Obviously it was received very well, but I'm curious to hear what people had to say about it.
Well, number one, a lot of professionals in the field were like, I can't believe I didn't come up with this idea. Because right. Especially like the marketing people, they had lists that they were
Sure.
compiling of all the options so that they would know where the other communities were, their competitors, for business analysis. But no one had really thought to sort of create a consumer based directory. One of my things was and it may have been a little bit, so people embraced it, but I was really young. I was in my early 20s, and I didn't have industry knowledge. I was just learning as I was going along. And one interesting thing is now, nationwide, the term assisted living is, people
pretty common. Yeah.
use that, pretty
right.
common. Back then, 33 years ago, in Maryland, D.C., and Virginia, they were calling them board and care homes and, retirement homes and things like this. And actually, like, I have one of the marketing things for Sunrise Assisted Living, or Senior Living, which is one of the largest companies that is out there. At the time, they only had 2 locations, and they were calling them Sunrise Retirement Homes. So, but what was interesting is I was looking at all of this, and I had to create a category
right.
with a label, and I decided to create that section as like, this assisted living term that's being thrown out there a little bit is a lot easier to understand. And so I just threw a dart at the dartboard, and I'm glad I threw it at the right at the right term.
Steve, did you coin the term assisted living?
Oh, no, not at all. Other
Maybe
people
you
were using
popularized
it.
You made it more mainstream.
I think one thing, at least in the markets where I was doing this book, is because we were kind of lumping everybody under this umbrella. It really helped because at the time, Virginia and Maryland, there was sort of a legal name that they were supposed to be using. And by me sort of not worrying about the geographic boundaries, they can still use any name. And we described the different categories in our articles. So anyways, interesting stuff. It's been a really fun journey.
And let's talk about that fun journey, because your experience as a resident in a senior living community at 45 is rather astonishing. You knew you wanted to be an expert in senior living. And what better way to become an expert than to learn firsthand, right? You lived temporarily in 5 different senior communities. What was that like, and what did you learn?
Oh, it was probably one of the most awesome decisions and eye-opening experiences in my career. And let me kind of back up a little bit. So remember, I started this at age 20, right. And I definitely was a pioneer in sort of categorizing and organizing all these complex elder care options. I had also visited over 500 communities. I'd interviewed hundreds of people on their transition from their home into a community. And I was regarded as this senior housing expert, So if some media was doing an article, they'd call, "Hey, I heard you're a senior housing expert," and this, that, and the other. And at some point so at 43, I was over 20 years experience in this field, regarded as the senior housing expert. And I was at a client's at a community where they were asking me my opinion on something, and I said, I started to answer him, and I said, but the best way for me to answer that would be to just move in here and stay for a bit. And I've never done that, and that would give me a better perspective. And they looked at me kind of funny. They were like, really? And I said, yeah, it's sort of like, how can I be an expert? It's kind of like saying that I work at a restaurant, but I don't eat the food there. And so they called me a couple weeks later. I moved in. The first one was an assisted living community that was in the suburbs. I was not pretending to be anybody other than a healthy 43-year-old, okay? I actually had a classmate that did this in a nursing home where he was in a wheelchair and taking medications. And what I wanted to do is say, can these homes be a home to a person, not an older person or a person with a disability? And I have to tell you, these homes, and I've done it 5 times in a very different communities, these are the best neighborhoods I've ever spent time in, okay? And the main reason why is the caring that the neighbor, so the blind spot in 33 years, what I didn't see is how much the other residents care for each other. So especially if you're in a big community, it's not like there's an RN that's going to be there at every corner when you need help picking something up off the floor. It's the fellow residents. And the sense of camaraderie. And whenever I would go back home to my family in the suburbs after one of these adventures, I really felt lonely because being part of that community in close proximity to people and knowing that people care about you was a lot of times
feeling. When we talk to people, that's always sort of the tenet that comes out is you have to have a network of people that are supporting you and that you can also support them in the journey. And especially if you have that network, then you can age in a much more and I don't want to say safer. It's just you don't fall into a lot of the pitfalls that a lot of people who are aging do because you have a network of support.
You're hitting on one of my hot buttons. And we've been calling this building your personal village. So AARP has been doing a study since the beginning of time that says that X amount of people want to age in place. Yeah, right. They want to age in place, and I get it. Okay. We all like the memories of our home and the sense of independence. I think the most important thing about aging in place is that you're living in a neighborhood that is not segregated. See, senior living communities are the last legal segregated housing that we have. You can build something that says young people can't live here, and that's one of the reasons why folks want to stay in their home and not age in place, because they don't want to move to an age segregated housing option, no matter how great it sounds. Okay. Now, the secret to aging in place is not hiring 100 different companies to help you. You might need to hire 100 different companies to make that happen, but it's building that personal village and having conversations with that personal village on, what are my dreams? What are my ideas? What are the things that I like to do? And how can I give you support? Sure. Talking about my village, and how can you help me if I need help? And if people would invest more time in doing that, the experience of aging in place would be better. But also what would be better is when they do decide to make the move, they can bring that personal village over with them. And now their personal village becomes part of the senior living community as well. And I feel like we're moving in this direction, but there's still a lot that we could do. But I tell you, one thing that's pushing us in this direction is the huge amount of people that are out there that can define themselves as solo agers. This is, we do a weekly discussion in my community on a variety of topics. Our most popular topic is solo aging. There are so many people that are out there who either have outlived their family, they may be divorced, they may be a widow or widower, or their family may be all over the world, and they are taking full responsibility for what their steps are in their care. And for these solo agers, building that personal village is even more important.
What are some other components of a positive aging community, and how does it help seniors and our communities overall?
I think the hardest thing is communication. It's having discussions with your loved ones about these choices. It's being involved. That is what I see as the hardest thing for people to do. And like, let's talk about one of the hardest things that we can talk about, talking about death, and that's one thing that I found when I made these moves into these senior communities, that the residents of these communities it's almost more of a beautiful dialogue about end of life that I think for younger generations is a little bit harder to talk about. And but because they're just by default, they're in a community where they're seeing their friends and their loved ones pass away at probably a higher rate than those of us who are younger. It becomes a more normal conversation. And when it becomes a more normal conversation, you can now share with your loved ones and those people around you what your wishes are. And that's one element there. Another element that I would bring up, and as you can tell, I can babble on all this
please.
stuff.
This is fascinating.
The use of technology. I think that we have we have a huge problem in terms of getting enough people to care for elders that need assistance. Okay, with the shifts and then balances in
Supply and
the
demand.
demographics. And then just people that want to do that job and can do that job well and are committed to it. And technology like Alexa and Google Home, just my watch here is tracking a lot of my healthcare status without me knowing it. Instead of having the "I'm fallen and I couldn't get up" devices around our neck, we can now have sensors that are monitoring if I fall or if something happens, and I don't even need to think about it. These are some exciting developments that can save people money by utilizing technology, meaning they don't need as much
Paid care.
personal care that they need. Yeah. But it can also communicate with our loved ones and our healthcare providers a little bit better. Some exciting things out there. When people ask me a lot of times people will ask me, they'll say, "Hey, what is the best technology out there for older adults?" And I don't think there's anything best because we're all unique. But one of the elements of one of the tech elements that I like is Go-Go Grandparent. And what Go-Go Grandparent is if you're not skilled at using one of these things, it can be very difficult to get an Uber or a Lyft ride. Go-Go Grandparent enables somebody with a rotary dial phone to get an Uber or a Lyft. And they're using technology so that we don't need to necessarily use technology, similar to the way that the Amazon Alexa works. I don't need to page through a bunch of apps. I just, talk to Alexa.
Say, "Hey, Alexa."
Yeah, exactly. And the good thing
I'm
is,
sure it probably popped up.
well, I got Google Home in this room, so that's good.
Nice.
Anyways, okay.
No, it makes a lot of sense. And, I'm going to thread this needle and kind of bring it all full circle. So aging in place, even though everybody wants to do it, it does have a lot of unfortunate social isolations. And society, has always, recently, especially in the last 30 years, has somewhat been trending in that direction. People kind of don't mind that they're by themselves, right? And even though we're always talking about the necessity for community. So it reinforces, aging in place, in my opinion, reinforces this social isolation. And if you don't build a circle of support, or as you describe, kind of the network, right? Then you will fall into that trap. And I think that at some point you can get so far down the rabbit hole of being by yourself that it's hard to get out of it. And I love the fact that they're creating these retirement communities. I grew up in Atlanta, and every time I go to visit my parents, there are 50 plus communities popping up everywhere. And I'll tell you, what's interesting about the technological component is, I think, even more so than the aging in place aspect, I believe that if people aren't accessing these retirement communities and compounding technology and aging in place, I think it's going to exacerbate the social isolation, because people typically have most of their interaction with human caregivers, statistically. And so the fact that people are coming around to the idea that living in a community that's 50 plus, that's a senior community, and they are embracing it, is going to not just solve some of our significant issues when it comes to care, specifically the supply and demand issues, but I think it's going to finally destigmatize what these communities are meant to do. And I think it'll help people in the long run live longer and happier lives. Not to sound cliche, but it's true.
Oh no. Yeah. And one little tip that's worked with some of the members of our community is that there's a lot of folks that are out there, and they'll get our guide, or they'll come into a discussion, and they're like, okay, I've toured all these places. I and I'm not ready for any of them yet, but I do want a more carefree lifestyle. And one solution that has worked really well is what I've sort of coined the term smart lifestyle community. These are generally apartments. And I say apartments because an apartment is something that you can rent and see how it works, okay? Yeah. Versus a condo, it's a transaction and you're stuck with the condo fees and this, that, and the other. But I always recommend folks is utilize the website WalkScore, use the AARP Livability Index, look into apartments, and the most important thing to be close to is a grocery store. You don't need to be close to hospitals because hopefully you're not going to have to go to a hospital, but a grocery store is something. And the beauty is here in the DC metro market, and I know a lot of larger markets, we're getting these sort of urban, suburban cities, and a lot of times they're putting a Harris Teeter or a grocery store on the bottom level of an apartment building. What a great place to live.
Amazing.
And by renting, you can experiment with downsizing, see if you like that lifestyle. And a lot of times there's a lot of empty nesters in these urban, suburban apartment buildings. And then, you know, if you like it, great. If you don't, move back to your home. If you feel like you need more care and a healthcare safety net, then maybe you can move to a life plan community from there. But that's one tip. If the stigma really bothers you, that's one way to get around it.
Good point. Positive Aging Community isn't just a company name for you. It's a philosophy. Would you mind sharing how this philosophy impacts the approach of your organization and how it could impact our listeners?
Yeah, wow, great question. And so one of the things, the term positive aging, and here again, I didn't sort of coin this term or anything like that, but one term that I did coin was pro-aging. And you can get to our website at proaging.com. But I coined the term pro-aging for professionals in the field of aging, but I then realized it's like, wow, this also has another point to it, which is positive aging. And this, I like that term pro-aging, positive aging, because in general, in our culture, ageism and the stigma of growing old and the things that are the beautiful wrinkles and gray hair that we develop, we don't look at them that way. And so if I do have a philosophy, it's to look at this chapter of our lives as not one of decline and depression, but one of opportunity and exploration and wisdom, and the fact that you don't have maybe some of those biases that you had when you were younger. It's not easy though, because if you've got healthcare changes, if you have loss and grief, reinventing yourselves and finding purpose in life can be challenging. But one of the benefits of being an elder is that you can't live on this planet for 40, 50, 60 years without solving a lot of problems and overcoming a lot of challenges. And it's just, looking creatively and positively, sorry about that little, and really embracing this chapter in our lives.
As an expert in senior living, what do you believe is the biggest misconception about this experience?
That it's any different than any sort of chapter in our lives that we have gone through before.
Sure.
So, I mean, and that's one of the things when I'm talking to people about this transition, nobody wants to move to a senior community. Now, when they move there, I've interviewed hundreds of people, they love it. And so when I work with families and individuals, I say, look, you're not looking at an old folks home. Let's pretend that you're going to find the next college you're going to. And let's sort of compare these two things. A college kid walking onto a campus, he's not thinking about this being decline. He's thinking about this as being
an opportunity,
a new positive experience. And that's what this chapter can be too. Also, a college kid, when he walks on that campus, he doesn't care about the square footage of his dorm room. Mm-hmm. It's the other students on the campus.
Right.
And that's what we should be doing too, is that the new people I'm going to meet, the new experiences that are going to be. But in the case of an elder going to a community or aging in place and getting out there and joining a new club, they have life experience that they can really share. Your typical 18-year-old doesn't have any life experience. He or she is trying to gain that.
Right.
But your typical senior living community is just, you could staff a small college with the residents that are in any of these communities.
I mean, why do you think that we have experienced the stigma that we're describing? And also, secondary to that, is it improving? Meaning, are people starting to shed that stigma?
It is improving. I think one of the reasons that we have the stigma is that, let's say that your pursuits in life are primarily athletic. And as you grow older, it has nothing to do with you growing older, by the way. I mean, there's people that get injured and blow out a knee when they're in their 20s. But as we grow older, many of us is like, oh, I can't swing a golf club like I used to, swing the tennis racket, ride my bike, what have you. And so it can oftentimes be looked at as, oh, because I'm growing older, I have to give up these things. Okay. Now, but again, this happens at every stage in our life. So what are some things that we can do to make this better? One of the things I like to spotlight is how it's perfectly acceptable to go to a birthday party for somebody over a certain age and give them this horrible birthday card with all this black humor, with the Grim Reaper or them in a rocking chair, and that their life is over and this, that, and the other. And that's acceptable. In fact, you hand that card to somebody and they'll laugh right along with you. And I think little things like that, if we start moving the needle to, if you get a card like that, use it as a opportunity to have a dialogue, about what growing older can be and what it should be. But number two, just stop giving cards like that. There's so many positive cards that are out there. Again, going back to the college age kid, look at the cards for a high school graduation and then look at the cards for retirement. And this one over here is full of black humor. There's no black humor. This is, a new chapter in life. This is exciting. They should look exactly the same. They should be exactly the same. In fact, I tell people, when you go to a retirement party, give them a graduation card, because retirement is the most exciting graduation in our life. We're just moving to another chapter. I know I've been babbling there. Hopefully you get a few ideas.
That was perfect. Yeah. I think essentially what you're saying, and this is something that I'm always fascinated with, is how we've socially engineered our society to think in the capacity that you're describing. And we talk to a lot of people about ageism, and I'll be honest, I haven't really taken it to heart until we started the show and started to really understand the impacts that it has within the senior community. And then you have the personal experiences. Like, for example, my in-laws are well into their late 70s. I have some people that I work with who are, 95, 105. And I talk to my in-laws, and they seem somewhat concerned with their age, whereas the people who are in their 95 and 105 ages, they're talking about, hey, next year I'm going to move into a bigger place, or I'm going to be closer to not the senior citizen center. No. I'm going to be closer to the Target that's down the road, because I love going there. And they're 90. I mean, one of the guys that comes to mind, he's 102 years old. And so and I can see the differences. And one listens to the the directions that, society gives them about how they should feel at this age and how they should, you can't run anymore, so you might as well just pack it all in. Don't go to the gym, don't use the elliptical, don't go swimming and do water aerobics. Just go ahead and pack it in. You're done. You don't get hurt. God forbid that you fall and hurt yourself. This other guy's like, I'm do whatever I want.
Yeah.
I'm going to just keep going. I've been alive long enough so I can listen to my body. So I totally understand what you're saying.
I love it.
Taking a look back, you founded Retirement Living Sourcebook in 1990. Over the past 30 years, working in senior living, what's changed the most?
I think there's more choices out there. Back 30 years ago, the category of assisted living really didn't exist. And that's one of the reasons why a lot of us have these horrible stigmas of nursing homes, because basically the people that are now in assisted living were there in the skilled nursing center. And that was tough. It's tough to see mom and dad who just need help with one or two activities of daily living with somebody who is totally bedridden. And so the amount of choices that are out there is increased. One of the challenges that we face is addressing the needs of what they are referring to as the forgotten middle. It's this group, and there's more choices coming out there, but it's this group, if you're impoverished, we've got Medicaid, we got the PACE program, we got things like that. If you are wealthy, you've got plenty of opportunities that are out there. But it's this group in the middle that I've always referred to as the caught between the cracks group. And it takes more creativity there. Middle. And we need more resources for that group. There are more resources than there were 30 years ago, but there's also more people needing this stuff than there's there. And it seems like, as you were talking about, like, Atlanta or whatever in this market too, is that there's a lot of new communities being built, but they're primarily being built for folks with assets and income.
Right. So, what do you suggest as some of the solutions that we can take?
The only solution, is what we were talking about, is building your personal village. Because if you can cultivate a personal village, and it doesn't necessarily need to be friends and family. It can be like in some markets, there's shepherd centers where there's volunteers that help out. It could be your church group. It could be, but if you can cultivate a village of unpaid support, then it stretches your dollar longer. So somebody who might need home care for 5 days a week, if they could utilize technology and their network to provide care for 3 of those 5 days, now they're only paying for a caregiver for 2 days, and that could stretch your money for many years. So
Absolutely.
That's the only solution I can come up with. You can't build communities fast enough.
I know.
And what are you building? 100 apartment affordable community? You probably need 500. And it takes 3 years to build.
And I think people need to really take into consideration what the word affordable actually means when it comes to people that are retiring. I think if you look at the statistics, 60% of Americans that are retiring with just basic Social Security. So there's about 30% that are retiring with about an average of $250,000 in savings, and then obviously you have the 10%. Those 60% are drawing around $1,200 to $1,800, a month. That's not a lot of money. And when you're a builder and you're looking to extrapolate as much bang for your buck, so to speak, I think that it's going to be necessary, especially as we progress into more of an aging population, for the federal government to try and consider subsidizing some of these projects, because not just having the conversation today, which has been exhilarating and also has made me really consider how important these retirement communities are, but we need to accelerate that. I think you and I are both on the same page when we say, like, we don't have enough housing and we need more, and we need it to be affordable. So, and we need it to be for the 50 plus, so that all those people that are millennials and Gen Z who are complaining about not being able to buy a house have access to buying a house, you know? So killing two birds with one stone, so to speak, you know? I want to talk about your experience. What's the hardest part of getting older from a social and communal perspective, and what can we do to ease these hardships?
Oh, man. You know, I know I sound like a broken record.
No, please.
But communicating with your loved ones around you in advance, it solves so many problems. And like, so I know it's hard, but most of the calls that I get on a weekly basis are a loved one who is flying into town because mom fell and they don't know anything about mom. You know, they don't know what she wanted, this, that, and the other. And then they might look at the situation, you know, coming in for the weekend, and it's like, Mom, we got to get you to assisted living. No way, I'm not going to one of those places. And they had some conversations,
some planning
years in advance, and it doesn't need to be this hard, you know, 8-hour conference call. It's just having conversations. And a lot of times the best way to have a conversation is saying, if there's somebody in your life that may have dementia or cancer or a mobility issue, it's sort of like, hey, what would you want us to do, or what would you want to do if you were in this situation? Now, if somebody says, and they will say this, oh, I'm healthy, that's not going to happen to me, you know, it's sort of like, look, this happens to people that run marathons, and I'm just asking you, let's just have a little conversation here, because I've been thinking about this. Like, the other thing is, not when you're talking to a parent, it's not sort of putting it in sort of like and this is another problem is that if you start talking to an elder as though they're like somebody different than you, talk about it as yourself. You can be in your 30s and 40s and think about, what would happen if I develop dementia? Where do I want to be cared for, in my home or somewhere else? So,
and even understanding the process of, like, who's the PCP, you know, or who is your Medicare with, you know, and especially, you know, you probably know this with being in this industry for so long. The majority of Americans don't understand how Medicare works. You know, they don't understand what Medicare Advantage is. They don't understand what a supplemental plan is. They don't understand how the structure of the system works. And so I think at least asking, like, hey, you know, what's your doctor's name? Or, you know, what insurance do you have? Simple questions like that, so that at least you're at least somewhat prepared in the very most minute amount, but you're at least prepared to help when the time comes. So we always like to end the show with a call to action. Positive Aging Community offers a wealth of resources on senior living. How can we use digital tools and online communities to create more positive outcomes for people of all ages? I would say, folks, visit our website, proaging.com, and we have these weekly discussions on every topic under the sun. Ageism, solo aging, choosing and paying for a senior community, aging in place, and you're not being sold to. This is basically just open discussions. You can ask questions, and I am just
the pandemic brought this on to our business, and I'm thrilled because for me, it's like a support group that I get to wake up to and look forward to every day that we have one of these discussions. And I just say to your listeners, feel free to join us because I feel like, whether it be jumping in on our positive aging community discussions or joining a support group or just inviting your friends over, and there's this concept, death over dinner. Check out that book where you can host a dinner party and the conversation is about death. There's so many creative ways that you can build your personal village or connect to another community like ours to just help make this chapter the most wonderful and set an example for the generations that follow that, man, this is something to look forward to, an adventure. As every day that we're walking this planet should be.